The County of San Diego conducted a community health needs assessment, and in the top 3, diabetes came out number 1. And what they realized is people that were coming from underserved communities were not receiving the best diabetes care possible, and reached out to see if we could help them develop a program that might help improve that care. Project Dulce focuses on diabetes and its comorbidities. It uses nurse care management and peer educators embedded in a primary care health environment, and it does it in underserved communities that are racially and ethnically diverse. Diabetes is growing at an alarming rate, and we can see that especially over the time that Project Dulce has been in place from 1997 until today. Lack of access to healthy food, lack of safe places to exercise, and lack of education. And this is really the heart of what Project Dulce is trying to get at. Let's improve the education, and then that translates into better health in the long run.
Alameda, we have been working with them since 2006. They adopted Project Dulce in the public health department, their own diabetes education program. So they've been doing that for many years. We trained community health centers, Roots, Tiburcio, that are extending the program in their own region. Adventist is similar. We connected with them when we were working in the Central Valley. They have a lot of rural health clinics, and they're taking the program to places like Lodi and Sonora, Modesto. So they're out there in the rural areas, and we're giving them the tools, the curriculum, the assistance they need to take the program out.
What we showed is that glucose values improved over time, cholesterol and blood pressure, which also improved, critical pieces when you're taking care of diabetes. We found that the costs overall for admissions to hospitals would go down over time. And then finally, the behavioral aspect, which can be so critical because without behavior change, you'll never make long-term change. People's concepts around how to take care of diabetes, why it's important to take care of diabetes, can change as well for the positive.
There are so many people out there that have this disease that don't have hope. So I want to tell them that there is hope for you. I'm at a loss for words. They saved my life.
The comorbid conditions are what cost the most. And if you can prevent those by improving health, you will ultimately lower the cost of diabetes. And that's a huge component of what we want to do in this country.